Dengue is one of the most infectious diseases here in the Philippines, having infected up to 80,000 Filipinos in 2021 alone. Now, as the rainy season begins, the chances of getting infected by dengue increases as well, which is why in today's episode, we'll give you tips to avoid infection and keep yourselves and your loved ones protected. I'm Dr. Freddy Gomez, and welcome to MedTalk Health Talk, only on CNN Philippines. Our guests are here today to give their insights on dengue. With us is Dr. Carl Evan Henson. He is the director of the Hospital Infectious Control and Epidemiology Center at the Medical City. Also with us is Dr. Michael Campued. He is the president of the Philippine Society of Public Health Physicians. In the age of COVID-19, if you go to a hospital and you have a fever, your fever will be treated as COVID-19 unless proven otherwise. But did you know that before COVID-19 was here, any fever that you'd had was considered dengue unless proven otherwise? Now, I'll start the conversation with Dr. Carl. What I just mentioned, Dr. Carl, just shows how prevalent dengue is here in the Philippines. Why is this so? Could you explain to our viewers basically what dengue is and why is it so infectious?
Dengue is an infection caused by the dengue virus. And this virus is carried by mosquitoes. So not all mosquitoes carry dengue. There's a very specific species of mosquitoes. And these mosquitoes actually live in tropical areas. They came from Africa, but they're now very widespread in tropical regions. So this mosquito also can carry the other infections like Zika, chikungunya, etc. So they can cause a lot of problems. And that's why you see dengue usually in the tropical areas, because that's where the mosquitoes that carry these infections live.
Dr. Carl, you mentioned a good point a while ago that dengue is caused by a vector, a mosquito, which is also the vector for other diseases, which I'm sure our viewers have heard about. So does that mean that if mosquitoes are around, they are not just at risk for contracting dengue, but for chikungunya, for Zika as well?
It all depends on how prevalent the disease is. Among all of those diseases that we mentioned, dengue is the most common. So when you get bitten by the Aedes mosquito, you're more likely to get dengue than, say, Zika or chikungunya. So it's really more predominantly dengue these days.
Now, Dr. Mike, I'll go to you this time and talk about what makes an area endemic for dengue. Because I'm sure maybe our viewers who have had dengue before, they will notice that if they contracted dengue, it's not just them. Probably a neighbor has had dengue as well, or probably a coworker. Kumbaga, hindi siya isolated, marami. What makes an area more prone to being infected or having dengue among several people?
What makes for endemicity is the presence of the cases. No? Pagka tinitingnan na natin yung mga lugar sa atin, no? What we recognize is that urban areas do have dengue cases, and at least we compare it across the Philippines as a tropical areas where Aedes aegypti or Aedes mosquitoes live, essentially would bring in the endemicity of dengue. And as long as there is a continued presence of the virus, then that's what we say na magkakaroon ka ng risk. Now, when we look at it environmentally, so titingnan natin, usually areas where a lot of stagnant water will make for an essential breeding ground as well for the virus.
Dr. Mike, what about malaria? Ang malaria, mosquito din, lamok din ang kanyang carrier. Pero bakit hindi siya ganun ka-common sa like what you said, urbanized areas?
With malaria, there are areas where the virus are actually found. So within the Philippines, it's not actually all over the Philippines. So we still have to establish the presence of the virus among the mosquitoes for us to say that there is the presence of that disease. Dengue was carried furthermore than malaria. Pero ayun, kalungkutang palad, meron pa rin tayong areas where we have malaria.
Now, Dr. Carl, let's talk about the symptoms, the common symptoms that might prompt someone to think that they have dengue.
dengue fever, so lagnat ang primary symptom niya, no? Almost all patients will present with fever. The other name for dengue is breakbone fever. Ibig sabihin nun, you get this high-grade fever, but also this muscle aches and pains. Parang bone pain yung kind ng pain that they experience. And when you have fever, you get the usual nakasama ng lagnat, a headache, we said muscle aches and pains, no? Some warmth in the eyes. And then some patient will describe this headache that seems to occur behind the eyes, yung retroorbital pain. So those are the most common. Some patients will get a kind of a rash on day 3 or 4 of illness. Pwedeng magkaroon ng non-specific rash that goes away by itself, no?
Now, Dr. Carl, do these symptoms when they come out, mas delikado ba ang mga simptomas na ito kapag bata ang may dengue or just as equal risk whether it be a child or an adult?
Actually, in children, most likely that children will present with a very mild or even asymptomatic form of dengue. No? They can get bitten and then they won't know it kasi very mild in symptoms. Pero dengue will infect all age groups and even healthy adults can get the bad symptoms of dengue.
When we return, we'll discuss what you should do if you get infected with dengue, right here on MedTalk Health Talk. I'm Dr. Freddy Gomez and welcome back to MedTalk Health Talk, where caring is our calling. Taking proper action and subsequent treatment for dengue is necessary as soon as symptoms of dengue begin to appear. So it's very important that you get the correct diagnosis for having dengue. Dr. Mike, how is someone correctly diagnosed to having dengue? Symptoms or kailangan pa ng blood test dito, Doc Mike?
So usually, when a patient presents with fever, that's what we call a suspect case, no? A fever, and then the symptomatologies that were described earlier by Dr. Carl, no? And then we come to a probable conclusion of dengue once we have rapid diagnostic test or any testing, no? Like for example, NS1 antigen test, yung diagnostic test natin, or you can see a manifestation in the blood counts, no? There's a decrease in platelet or the WBC of the patient. But what confirms a diagnosis is essentially the RT-PCR, no? Now have mga more facilities that are capable of doing that. But of course, no, we don't rely on that presence to begin action. Even at the probability or suspicion, begin action as we see a patient.
Yes, Dr. Mike, action is definitely important here. Dr. Carl, nakakamatay ba ang dengue?
In a word, yes. Dengue can lead to severe complications. And if it is not addressed properly and in the correct facility, then patients can die from dengue.
Okay, let's talk about that. Correctly managed. What is the initial move of a doctor in their plan to treat someone who is correctly diagnosed already with dengue?
Okay, so dengue essentially and in most cases is what's called a self-limiting disease. Sabihin nun, kahit wala kang gawin, pwedeng mawala yung symptoms on its own. But in a minority of cases, some patients will have the more severe forms. And this takes the form of what's called plasma leakage. So if that happens, you can get the complications of dengue, like for example, fluid around the lungs, fluid in the belly. Platelets can drop, leading to complications of bleeding. And because this is a virus, there's no one cure. There's no medicine that I can give you that will take away the virus. No? Kailangan the doctors must monitor the vital signs well, give the appropriate volume of fluids, and monitor the response of the patient to those kinds of fluids.
Dr. Carl, that's a good explanation of the management. But I'm sure a lot of our viewers, when they hear dengue, they hear blood transfusion. Is blood transfusion an automatic management for someone diagnosed with dengue?
Well, definitely not. No, we almost never ever transfuse in dengue. Parang very rare yung instances. I haven't had a case in recent memory where I've had to transfuse, whether platelets or blood or whatnot. No, because, like I said, dengue is self-limiting. The virus and the complications will go away on its own as long as it's managed well. No? So the drop in the platelet count, eventually in about 1 or 2 days, that will go up on its own. So unless there are actual bleeding complications, we almost never give transfusion.
Dr. Mike, for the most part, what we've learned so far, that the majority of cases of dengue is self-limiting. But of course, what sticks to the minds of a lot of viewers are those extreme cases of dengue. How does dengue go to that? How does stories of bleeding and complications from dengue reach that point? Does it have anything to do with certain types of dengue?
There are different vulnerabilities for each patient. And what we do understand in science is that reinfection with dengue is definitely a stage for you to get into the dengue hemorrhagic fever. So that's one thing that we can definitely say. No, if there is history in a patient with previous dengue, we worry about that and we make sure that the patient is actually within a facility that has readiness for hemorrhagic treatment. Pero doon sa mga other things that can actually increase the probability, it ranges. But I support Sir Carl. No, even me. No, we've been very conservative on how we see dengue, and it's not the first thing that we worry about when we see dengue. What we firstly worry is hydration. But patients that fail to actually hydrate, patients that fail to actually take care of themselves, patients that have pre-existing conditions, like, for example, a hemolytic condition, or a patient with an autoimmune disease, or patients that are already suffering some form of dehydration, these are patients that can be pushed. Once at the critical phase of dengue, di natin nalagpasan yon, then that's when we hear na we have to really look out at CBCs as signs in the changes in the blood counts.
When we return, we'll talk about what you can do to prevent dengue infection from spreading. We'll be right back on MedTalk Health Talk. I'm Dr. Freddy Gomez, and this is MedTalk Health Talk, your partner in healthcare. Now, there are plenty of ways to ensure that you and your loved ones are protected from dengue, and this is through proper prevention. Before we go to prevention, Dr. Carl, earlier Dr. Mike mentioned one of the risk factors of dengue progressing is that of a previous infection of dengue. This means someone who has had dengue before would probably have little or barely noticeable symptoms. How is that a risk factor for a succeeding infection of dengue?
The dengue virus has 4, I like to call them flavors, serotypes. Dengue 1, 2, 3, and 4. When you get infected with your first serotype, that's called a primary infection, and you can get a mild disease, etc. So there's parang cross protection but not complete, meaning that when you get infected with one, you get some sort of protection but not complete, and then it wanes over time. So your body, your immune system, develops some antibodies against the first virus, and it sort of partially will protect you against the 2, 3, 4 virus. So when you get infected with virus number 2 or virus number 3, then your immune system has this sort of seeming memory. It mounts an immune response, but the protection is not complete. That leads to more serious symptoms, because your body, your immune system is trying to fight off, but it's not successful at completely eradicating the virus. That leads to the more complications of dengue.
So just a reminder to our viewers, those who have had previous dengue infections, you must be extra careful with subsequent infections with dengue. With that in mind, let's talk about prevention. Dr. Mike, what are the best ways, the most practical ways, the easiest, most simplest ways Filipinos can do to prevent themselves from being infected with dengue?
That's very nice to actually hear, kasi that's what we really want patients to do. There are a range of actions as a society that we can do, but individually self-protection is very important. So the things that you can do is to make sure that you don't go out at the times when There are a lot of mosquitoes. Right now, it's quite vague on how we time now that the presence of mosquitoes outside, but we will make sure that at the time that we go out, especially if you're within areas where dengue is endemic, you have to wear long sleeves, long pants, or even wear insect repellents. No. Another thing that we can do is actually looking at breeding grounds of mosquitoes. No, there's the strategy of DOH which we call 4S strategy. No, which primarily points to search and destroy breeding grounds. No, when we look at areas, we have to remember na any small puddle or amounts of water can actually be breeding ground for mosquitoes.
So the 4S strategy, definitely, Dr. Mike, is something that all Filipinos must be aware of. Going back a little bit, you mentioned that the use of insect repellents, of course, is very practical, very handy, effective as well. But what's important, what can you share with our viewers on what is most effective in actually repelling the mosquito?
I haven't really encountered any comparative studies that looks at the effectivity of these. But I do think na firstly, yung chemicals like the DEET, they already are established repellents, but in moderated amounts. But for those that are more from natural sources, like for example citronella oils, they do offer effectivity as well. No, so definitely once the kind of like the oils of these oils actually mix into the oils of the body, and the scent that you're exuding is gonna be very deterrent for for mosquitoes. But what I think would be best is a combination of all these.
Now, Dr. Carl, going back to dengue per se, there's what is also termed by physicians as the critical phase. This was mentioned a little bit by Dr. Mike in passing a while ago. Please explain to us, Dr. Carl, what is the critical phase? Why is this so important to know?
So there are three phases in dengue: the febrile phase, the critical, and the convalescent. Febrile phase, as the term implies, may lagnat. When the fever goes away, so sabi natin kanina, 3 to 7 days of fever. Now, when the fever goes away, that commences the critical phase, where you can get the complications of dengue. You can get a drop in your platelet counts, and then there can be more plasma leakage. The patient can get short of breath. The blood pressure can exhibit some changes that are worrisome, what's called the narrow pulse pressure. And then if the patient is managed correctly, given the appropriate number of fluids, etc., then the patient enters the convalescent phase or the recovery phase. The critical phase, which is the 2 days after the fever goes away, that's actually the most important part where monitoring needs to happen.
Yes, that's right. That's why this is the phase where things can take a turn for the worst if not being managed and monitored by medical specialists. Before we go, some important tips for the viewers, especially when it comes to dengue. I'll start first with Dr. Mike.
Tips, definitely what I've mentioned, the 4S strategy, search and destroy, looking at breeding grounds around, and self-protection, seek early consultation, and of course the fogging. But critical as well is for you to actually report yourself if you have dengue. We have to be aware for our neighbors as well, to be aware that there is an increasing case around.
Yes, awareness is definitely important. And Dr. Carl, any advice to the viewers before we go?
Well, at the bottom line, really, the symptoms of dengue are very non-specific. Other diseases can present the same way. Fever, headache, muscle aches and pains, that can be anything. No? It can even be COVID and some of the other viral infections. No? So I think the most important message is if you have a fever, you need to consult. There are many ways now. You don't need to go to the emergency room. You can do teleconsultation. You can go to your doctor's clinic, etc. But I think the important thing is for you to consult your doctor.
Yes, consult your doctor. Definitely always a good choice. With that, thank you very much, Dr. Carl Evans Henson and Dr. Michael Campued for being with us today, sharing your tips and expertise about dengue. I'm Dr. Freddy Gomez, and thank you for watching MedTalk Health Talk. We'll see you again next time.